A person can feel healthy, take a pregnancy test, and within a few weeks be having blood tests, ultrasound scans, blood pressure checks, medication reviews, and appointments in a medical clinic. That looks a lot like illness. So does morning sickness, exhaustion, back pain, swelling, and the possibility of ending up in hospital. Yet doctors usually do not describe pregnancy itself as a disease. Why not? The clearest answer is that pregnancy is generally considered a normal physiological state, a major temporary reorganization of the body that is part of human reproduction. A disease usually involves a harmful disorder of normal structure or function. Pregnancy changes normal structure and function on purpose, so to speak, in order to support the placenta and the developing fetus. The changes can be uncomfortable, limiting, and sometimes dangerous, but the state itself is not automatically pathological. There is no single perfect definition of disease that settles every argument. Medicine also uses words such as condition, disorder, syndrome, diagnosis, and health state, and their borders are not always neat. A person can have a medical condition without having a disease. Nearsightedness is a condition. Menopause is a physiological transition. A broken bone is an injury. Pregnancy belongs in this wider medical landscape, even when everything is progressing normally. At 6 in the morning, someone may be kneeling beside the toilet because the smell of coffee suddenly feels unbearable. Later, the same person may fall asleep on the sofa at 7 in the evening and wake up needing to urinate again. Those are symptoms, but symptoms alone do not prove disease. Muscle soreness after exercise is also a symptom. What matters is why the symptom is happening, how severe it is, and whether the body is adapting safely. Pregnancy is an enormous adaptation. The uterus expands. The placenta becomes a new temporary organ. Blood volume increases, the heart pumps more blood, breathing changes, and the kidneys handle a greater workload. Hormones alter digestion, ligaments, blood vessels, metabolism, and the way the immune system behaves. The American College of Obstetricians and Gynecologists describes pregnancy as producing broad anatomical and physiological changes that must be considered even when prescribing something as ordinary as exercise. These changes are coordinated, but they are not free. Looser ligaments and a shifting center of gravity can contribute to pelvic or lower back pain. Slower digestion can mean constipation and heartburn. Increased blood flow and hormonal changes can bring headaches, nasal congestion, or bleeding gums. A normal pregnancy can make climbing one flight of stairs feel different. That sounds minor, but it matters when someone has an 8-hour shift, a toddler at home, and a bus that arrives only twice an hour. Then there is the placenta. It transfers oxygen and nutrients, produces hormones, and helps regulate the relationship between two genetically distinct organisms sharing one body. It is impressive biology, but it also creates new points of failure. Problems involving placental implantation, blood flow, or separation can become emergencies. The existence of those risks does not turn every pregnancy into a disease, just as the possibility of injury does not make every marathon an injury. This is why routine prenatal care exists. Blood pressure is checked because pre-eclampsia can begin with few obvious symptoms. Blood and urine tests can reveal anemia, infection, blood group issues, or changes in glucose handling. Ultrasound can help assess fetal development, placental location, and gestational age. The visits are not proof that the patient is sick. They are surveillance during a period when normal physiology can move into dangerous territory faster than it sometimes appears from the outside. A blood pressure cuff gives a boring little example. The patient may feel fine. The reading is repeated. The cuff squeezes again, someone checks the urine, and a routine appointment suddenly becomes a longer assessment. Pre-eclampsia is a pregnancy-specific hypertensive disorder that usually develops after 20 weeks and can threaten both the pregnant person and the fetus. Pregnancy is not the disease here. Pre-eclampsia is. The same distinction applies to gestational diabetes. Pregnancy hormones naturally change how the body responds to insulin, so that more energy can remain available in the bloodstream. Sometimes the pancreas cannot compensate enough, and blood glucose rises beyond a healthy range. That condition is gestational diabetes. It develops during pregnancy and often improves after birth, although it can affect the pregnancy and is linked with future health risks. Again, a normal adaptation has crossed into pathology. Nausea offers another useful boundary. Mild or moderate nausea and vomiting are common, especially early in pregnancy. Hyperemesis gravidarum is different. Vomiting can become so severe that a person cannot keep down fluids, loses weight, becomes dehydrated, or needs intravenous treatment. Calling every episode of nausea a disease would medicalize a common pregnancy symptom. Calling severe, persistent vomiting just pregnancy can delay necessary care. You see the problem. Some complications are even more clearly pathological. An ectopic pregnancy implants outside the main cavity of the uterus, most often in a fallopian tube, and cannot develop normally there. It can rupture and cause life-threatening internal bleeding. Placental abruption, serious infection, blood clots, or major hemorrhage are medical emergencies. These are diseases, disorders, or complications occurring in relation to pregnancy. They are not evidence that reproduction itself is an illness. Existing diseases can also collide with pregnancy. Diabetes, epilepsy, kidney disease, autoimmune disorders, and heart conditions may require different monitoring or medication decisions because pregnancy changes circulation, metabolism, and the way drugs are processed. The World Health Organization has emphasized that these physiological changes can alter the absorption, distribution, metabolism, and elimination of medicines. A dose that worked before pregnancy may need review. Stopping medication without medical advice can also be dangerous. A sticker on a medical file might say, "high-risk pregnancy." That phrase can sound as though a disease has already been diagnosed, but it usually describes probability, not certainty. Age, a multiple pregnancy, previous complications, existing illness, or findings during the current pregnancy may justify closer monitoring. Many high-risk pregnancies still end with healthy outcomes. The label tells the care team to watch more carefully. It does not predict the ending. Medical coding creates more confusion. The International Classification of Diseases contains an entire section for pregnancy, childbirth, and the postpartum period. That does not mean every item inside it is a disease. Classification systems are filing cabinets for healthcare. They include illnesses, injuries, symptoms, screening visits, and reasons for contact with medical services. ICD codes even distinguish supervision of a normal pregnancy from high-risk pregnancy and from specific complications. In the United States, for example, official ICD-10-CM guidance says routine prenatal visits without complications should use a code for supervision of normal pregnancy. The form may still have a box called diagnosis. Hospitals and insurers need a standardized code to explain why care happened. Administrative language is not a philosophical verdict about the body. The workplace question is separate again. Pregnancy may not be a disease, yet it can create temporary disability or functional limits. Someone may be unable to lift heavy boxes, stand for 10 hours, work around certain chemicals, or continue night shifts without changes. Severe pelvic pain, vomiting, anemia, or a complication may make work impossible for a period. A normal biological state can still require accommodation, leave, or medical certification. Not always, of course. Some people work and exercise comfortably deep into pregnancy. Others struggle in the first trimester. This is where slogans fail. Saying pregnancy is natural is medically true in one sense, but natural does not mean easy, harmless, or safe without care. Hemorrhage and infection occur naturally too. So does the body's tendency to form blood clots more readily during pregnancy, an adaptation that may reduce bleeding at birth, but also raises clotting risk. Biology is not a guarantee. The opposite slogan causes trouble too. Treating every pregnant person as fragile or sick can lead to unnecessary restrictions, anxiety, and loss of autonomy. The World Health Organization describes childbirth as a normal physiological process for most women and babies, while also stressing the need for skilled care and rapid response when complications appear. Both parts belong in the same sentence. So, is pregnancy a disease? In ordinary medical use, no. Pregnancy itself is a physiological state, not an illness. It can produce genuine symptoms, reduce a person's ability to function, worsen existing diseases, and generate new pregnancy-specific disorders. It deserves medical care because the body is doing something extraordinarily demanding, not because every pregnant patient is sick. The useful distinction is not between completely normal and seriously ill. There is a wide middle ground. Normal changes, unpleasant symptoms, increased risks, warning signs, treatable complications, and emergencies. Good maternity care respects that whole range. It does not pathologize every swollen ankle, and it does not dismiss a severe headache as part of the package. Pregnancy is one of the most medically supervised, normal processes in human life. That apparent contradiction is the answer. It is not a disease, but it is a state in which the health of a pregnant person and a developing fetus are closely linked, and small observations can matter. Normal does not mean nothing can go wrong. It means that, when things are going right, the transformation itself is the process.
Thanks for watching! If you enjoyed the video, please like, subscribe, and leave a comment below. See you in the next one!